So this next chapter is water and electrolyte balance. The next chapter after electrolytes, it's on page number 210. Page number 210, 210. So here, water and electrolyte balance. In this slide, they have mentioned 60% of total body is made up of water. In the book, it is mentioned 70%. It's quite debatable. Take the value which is given in the book for your reference. Okay, so out of this total water content which is present in this body, okay, divided into two parts: extracellular fluid and intracellular fluid. As I told earlier, can anyone repeat what do you mean by extracellular fluid? Extracellular fluid. Fluid that is present outside the cells, between the cells or within the blood vessel. Okay, so intracellular means automatically the fluid which is found inside the cell of each and every kind of tissue, from blood cells, bone cells, muscle cells, adipose cells, whatever, n number of types of cells we have in our body, nerve cells. Okay, in everything there is the fluid which is present inside the cells. There is fluid which is surrounding the cells, within the blood vessels, etc. So these are the entire fluid composition of our body: extracellular and intracellular. Okay, again in extracellular we have blood plasma. Okay, blood plasma is the general fluid within the heart and the blood. Okay, blood plasma carries the blood, rbcs, wbcs, etc. Okay, 50% of fluid is extracellular, 10% is intra. That may be some other reference. Okay, that half is you are taking 50% and 10%. Please read that slide again. I had mentioned the composition of sodium. If you sodium, when it is the distribution of sodium throughout the body. Okay, the topics are different. So blood plasma, you have blood plasma, that is the fluid which carries the different types of blood cells. And then you have interstitial fluid, that is the fluid which is which is outside the cell. Okay, interstitial between means between two cells. And other cells, other types of fluid which is mentioned in the textbook is fluid in the dense connective tissue. For example, you have cartilage, which is made up of dense connective tissue, bones, connective tissue. Okay, there are certain amount of fluid which is present in these areas also. So that is the fluid in the dense connective tissue. Transcellular fluid, for example, your saliva. Okay, uh, enzymes secreted by the pancreas, livers, the bile juice secreted by the liver. Okay, mucous membrane. Okay, mucus is also has certain kind of fluids. Okay, respiratory tract, mucous membrane of the respiratory tract, GI tract. So these become the examples of transcellular fluid. Trans means these cellular fluid is moving from the point of origin to somewhere else. Like the point of origin for saliva is the salivary glands. Um, it is sent into the mouth for the purposes. So that is transcellular fluid. It has been transferred from one part of the body to another. Okay, so this in this image you can make an idea of what are these different types of fluid. So intracellular fluid, ICF, within the cell, this is one cell. Interstitial fluid, you can see it is present between the cells. And extracellular fluid, interstitial fluid, is also means it is outside the cell. Automatically it is ECF. And then you have plasma, intravascular fluid. Vascular means your vessels, blood vessels. Okay, so intravascular fluid means fluid which is within the vessel but outside the cell. So that is also extracellular fluid. So I hope you understand what are the difference between this intracellular and extracellular, because when it comes to electrolyte balance, you should know these two terminologies. So functions of water. So first part is the part of structure. Can anyone say what would be what will be the meaning of this? Water forms structure. If you understood what is an intracellular fluid, it is very easy for you to understand the meaning of this as a part of structure. One function of the water is being a part of structure. Don't use the words or terminologies which is given in the description given the textbook. Just from your understanding, what do you think water forms a structure? Yes, body is made up of cells and cell is made up of water. Just imagine, take the entire water out of the cell. Will the cell collapse? If the cell collapse, the entire tissue will collapse. If the tissue collapse, the entire organ will collapse. If the organ collapses, entire system will collapse. If the system collapses, the entire body will collapse. Okay, so the function of the water is to provide structure, to provide that plumbness to the cell, so that it has a structure. If it has a structure, it will do its function. Okay, so that is what we mean by the part of structure. Okay, in textbook it is given, if there is a adipose tissue like fat tissue, the another name for that is adipose tissue. 1/5 of the fat tissue is made up of water. Okay, your muscle, 3/4 of your muscle is made up of water. So you can understand muscle gives a structure to your body. Okay, so in the absence of water, how you will look? Completely dehydrated, wrinkled. Okay, provides turgor means provides plumbness, fullness, the same thing. Okay, provides. Yeah, in the textbook it is given 70%, and in certain resources available online it is given to 60%. So from article to article, different sources, the 70-60 changes. Okay, so rely, for exam purpose, rely on what is given in the textbook. If you come across any article which says 60%, don't take it as a wrong answer. It can also be a right answer. Okay, so providing turgor means it provides fullness, plumbness to the tissue. Okay, because when the cells are filled up with water, it has a proper, it is distended. Okay, when the cell is distended, there is a there is an osmotic pressure on the cell membrane through which electrolytes can come inside, go outside through the cell wall. The electrolytes can pass through the cell wall. Okay, when this turgor is not there, when the cells are not properly distended, okay, osmotic pressure will not work sufficiently. Acts as solvent. You can explain that, anyone can explain that in the text, in the chat box. Water is a universal solvent. Have you heard of that phrase? Any example, if anyone can give of this solvent, how water is a solvent within the body? Any one example of what the water is able to dissolve? Simple, it starts at your mouth. Saliva is made up of water. Okay, 98% of saliva is made up of water. You have food. Okay, the saliva is able to mix up with full food, dissolve the simple carbohydrates then and there itself within your mouth before it reaches the stomach. Okay, so that's an example for that. Yeah, water soluble vitamins, sodium, those are the complex part. Once things are broken down, then again these simple items will be dissolved. Okay. Reactant, water does participates in a lot of enzymatic reactions which takes place within your body. Okay, like breaking the bonds, giving out hydrogen. Water means H2O. When it mixes up with certain chemicals, certain kind of oxidation goes takes place, hydrolysis takes place, different kind of enzymatic action will take place within the body. So hydrogen is released, oxygen is released. Sometimes water is the byproduct of various chemical reactions that is taking place in the body. That also takes place. So that is why water is a reactant. Lubricant, just the example of saliva. Okay, if your mouth is dry, can you it is so difficult to chew, you can't mix the food properly. It will be so difficult for the food to travel from your mouth through the esophagus and to the stomach if there is no saliva, no mucus secretion in the esophagus and all. Okay, so water is a lubricant. It regulates body temperature because water is a good source, conductor of heat and electricity. Okay, that's basic chemistry. Water is a good conductor of heat and electricity. So it is able to carry heat throughout the body. It is able to distribute heat throughout the body, and that is how it regulates the body temperature. Okay, that's an innate property of water, being a good conductor of heat and electricity. Dietary minerals, now you have advertisement on this. RO purified water, RO mineralized water, Bisleri water has mineralized water. Okay, Aquafina mineralized water. You must have come across these terms in the advertisement and all. Okay, so that even it depends upon the source of water also, how rich it is in certain minerals. The source of the water depends a lot when we have to claim it for certain dietary mineral effect. Okay, for the common dietary minerals found in water bodies are like freshwater bodies are calcium, magnesium, sodium, zinc, copper, iodide, fluoride, and all. So it dietary minerals largely depends on where you are getting your water from. Then other examples are water helps in mineralization of organic compound. So there are, I told you, there are certain chemical actions that is taking place within the body in which, for example, carbohydrates, some carbon atoms and hydrogen atoms will go off during a chemical reaction, and water will carry some sodium ions or some other ions and attach it to the carbon skeleton. Okay, so that is how water mineralizes other organic compounds. Organic compounds usually do not have mineral value to it, but once it gets mixed up with water, water is able to give certain minerals off to the organic compounds. So these are the different functions of water. So how much water you should drink in a day? More than half of the population uh, in the age group which is given here, they do not drink enough water. We all know that. Okay, more than half of the population uh, in the developing countries, most of them do not even have access to clean water. That's another issue. So yeah, depending upon your body weight, a list is given. So and also in table 11.1, requirement, water requirement by ICMR is given for a man, woman, children, boys, girls within different age groups, and for an adult man and woman based on their lifestyle, what is the amount of water they should be consuming is given in the textbook, and based on their weight, it is given here in the slide. You can refer any one of this. If you want to take a screenshot of the slide, you can take that. You can refer that also. So based on your weight, it will water consumption will be determined. So sources of water. Drinking water, obviously. Foods and beverages, when you cook a food, it has certain amount water quantity to it. Beverages, tea, coffee, soft drinks, cold drinks, whatever you have. Then you have metabolic water. Metabolic water means, I have told you, certain chemical reactions that takes place within the body. For example, oxidation of fat. When you have a food which is rich in fat, or any food that has basic fat, carbohydrates and proteins, okay, when breakdown of those fats, proteins and carbohydrates is taking place, water is a byproduct of that. Okay, and how much of water you get from breaking down 100 grams of fat, 100 grams of carbohydrate and protein, it is given in the textbook. For example, oxidation of 100 grams of fat will give 107 gram of water. That is almost 1 that is almost 107 ml of water. Very small amount, but still, water is metabolic water means what? The water which was the byproduct after certain metabolism of carbohydrates, fat, or lipids. Okay. So these are this source of water is internal. Your body itself is reserving this metabolic water. Okay. Drinking water, foods and beverages, these sources are external. So water balance, you have fluids, water from food, metabolic water which is already present in the body after metabolism. Okay, these are the intake and loss either through your feces, sweat, and urine. Okay, this balance should be optimum for the perfect functioning of your cardiovascular as well as your urinary system. So how does a natural water balance takes place in the body? First is your thirst mechanism. Okay, for example, when your body is dehydrated, okay, the first thing what happens is your mouth area tries, mouth and throat will become dry. Okay, that is a response. Okay, and to that response you will go and have water. Okay, that's how thirst mechanism works. There is a lots of technical things going on, like sensory nerves involved, osmoreceptors involved. Those things are technical because you know each and every part of your body from your head to your toes, they have nerve endings, nerve receptors. Okay, for receptors for various like pain, pressure, temperature, etc. Okay, also for physiological functions also there are nerve receptors. So the sensory nerve receptors in your mouth will identify dehydration in the body, and it will secrete less of saliva, because what it is trying to do, it is actually trying to save water as much as possible. Saliva is made up of water. In trying to save the water from the saliva by decreasing the secretion of saliva, your mouth will become dry, your throat will become dry, and that's how thirst mechanism is created. Okay, then you have kidneys. Kidneys will more than the metabolism. Kidneys are mainly concerned with how much of water should be excreted from the body, depending upon the hydration level within the body. If the body is too much dehydrated, the water output will be reduced. If body is adequately hydrated, the water output will be adequate. Okay, so remember that every 2 hours, 12 to 15 liters of your blood plasma is continuously being filtered out. Even as we speak, even as we sit down, your kidney is continuously functioning and continuously it is filtering out the blood plasma. So within 2 hours, the kidney is able to filter out 12 to 15 liters of blood plasma over and over again. Okay, so that is how it creates enough amount of urinary output made up of water. Then you have maintenance of fluid. Maintenance of fluid is the osmotic pressure, just how I told you, intracellular and extracellular. If when there is a sodium retention, for example, not the not too high, but slowly the body has sensed that sodium is increasing day by day in the body. So first it will get accumulated in the cells, And when lots of sodium ions are present inside the cells, obviously osmotic pressure inside the cells will rise because fluid retention will take place. Lots of fluid is getting retained within the cells. So as a defense mechanism, the cells will try to pull out this extra water and sodium, and it will dump it into the blood plasma or into the interstitial space. Interstitial space means interstitial fluid, and that is how the body goes into the stage of edema or swelling, because there is a lot of interstitial fluid between, like there is a lot of fluid accumulated between the cells. And also blood is also carrying a lot of fluid than normal. So and as soon as the blood is carrying a little bit higher amount of fluid, automatically when it is continuously going to be filtered out in the kidney identifies that the blood is coming with a lot of fluid, a lot of water has to be removed. That is how the osmotic pressure makes sure the water is in balance, water level is in balance within the body. Okay. Then again, edema, the same explanation. Okay, from the interstitial space to the from the intracellular space, the water and sodium will travel to the interstitial space or to the directly into the blood plasma, and that leads to edema. When a body is in the state of edema, the kidneys will be overworked. Remember that when the body is in an elevated state, when the body is having an overall swelling, the kidney will be overworked because kidney has a task of removing as much of water possible within a small amount of time, so that the body comes back to that normal equilibrium. So this edema takes place usually when your sodium chloride and your table salt intake is in excess. So that's the first reason why a body may go into an edematic state. Then hormonal reasons are others. Okay. Dehydration, when you have too less of water. So dehydration is a condition, or water depletion is a condition in which water is depleted in the body. It may be due to insufficient intake, either you're not taking enough water or excessive loss of water. Okay. So due to loss of water, what are the cases in which there is excessive loss of water? Okay, if you are living in a very hot tropical humid climate, okay, you will sweat a lot, and that's how your skin releases a lot of water. And excessive exercise, having a heavy cardio workout, okay, fever, as soon as you have fever, when the fever is trying to subside, you will sweat a lot. Okay, and also in case of hyperthyroidism, those who have hyperthyroidism, if even if you shake hands with them, their hands are very wet, very clumsy, okay, because of their body producing excess sweat. So these are the increased, also from lungs, when a patient is asthmatic or has bronchitis issues, okay, and when the patient is hyperventilating, for example, when you came back from a small run, okay, you try to catch your breath, okay, that point of time you are hyperventilating. So a lot of oxygen, when you're hyperventilating, a lot of oxygen is being released out of the body, and from where this oxygen is coming, because water has H2O. Okay, so water is undergoing the oxidation process to release excess of oxygen. So water depletion is taking place in the areas around the lungs. In urine, when a person has diabetes mellitus, because of osmotic diuresis, frequent urination is one of a classical sign of a diabetes patient. Okay, drinking seawater, and various kidney disorders, diabetes insipidus. Okay, like diabetes insipidus is classic case of salt and water metabolism disorder. The body is not able to metabolize, break down salt and water. Okay, so these are the reasons through which there will be an excess loss of water. And due to deprivation of water electrolytes, like why there is a reduced intake of water. First case is when the water is unavailable. Clean water is very hard to get in certain parts of the country. Okay, and in some cases of calamity or disasters, when people are stuck with no food, no water. Okay, inability to obtain water, for example, in case of infants, elderly infants can't say that they want water, they are thirsty. Okay, they do not have the uh, they do not have the speech yet. Okay, so in that case, and the people who are unconscious patients can't say that they want water. Okay, elderly patients, debilitated patients, like who are completely in care at others hands. Okay, they can't speak for themselves, they can't ask for water when they're thirsty because of certain underlying diseases. Okay, inability to swallow, there are certain diseases of the mouth or esophagus, mouth cancers, esophageal cancer, any diverticulum in the esophagus and all. Okay, so those will lead to deprivation of water. So causes of dehydration: excess diarrhea, vomiting, excess sweating, adenocortical dysfunction, when your adrenal glands are not functioning properly because of certain kidney diseases, and deficiency of ADH hormone. These will lead to dehydration. So effects of dehydration you can read. The main evidence is sunken features. Your cheeks will go inside. Your skin will look very dry, like dry and wrinkly. Okay, the orbital areas of your eye, that will be sunken. Okay, it will be dark sunken. Your lips will be chapped. Okay, lips, the angles of the eye, you may have angular stomatitis. Tongues will be dry, or the mouth will be dry. So these are the sign features of dehydration. The skin becomes loose and it lacks elasticity. Now when you are properly hydrated, when you pull your skin and leave it back, it will within less than a second it will go back to its normal stage. But when a body is dehydrated, when you pinch the skin, pull the skin, it takes time to go back to the normal state. So that's one classical sign of dehydration. Okay, so you just read through the effects of water deprivation. It's very easy. Then we have water intoxication. That occurs when water concentration is too high in the body fluid. So what happens is the cells will take up lots and lots of amounts of water. Okay, and it will try to get the levels back because um, it is trying to compensate for the electrolytes also, with the electrolytes which are lost because of too much of water. The electrolytes which are lost, or too electrolytes, they had become so soluble that it is negligible, the presence of electrolytes is negligible. To compensate that, the cells will try to get more and more water, thinking that if I get more and more water, more electrolytes will come. So what happens, the cells will swell up and it can eventually burst. That's a fatal case. Okay, just imagine the cells in your body is so swollen up that it had to eventually burst. That's a very fatal case. Okay, it's a very lethal condition. So increase in intracellular water is a very lethal condition. Water toxicity, so obviously water intoxication requires medical assistance. It's a medical emergency case. Through diet and nutrition, uh, do not try to solve such cases. It should be handled by the medical team, by a certified medical practitioners, these cases. So electrolytes, again, in this chapter also, you will come across the same three electrolytes which we have spoken on: sodium, potassium, and chlorine. So no need to go through this again, because in this chapter they have given too much of technical details that is not necessary from exam point of view. Okay, and even people from the commerce background may find it very way too difficult and hard, and it is not necessary for a simple practice or for your own knowledge. Things do get technical here, so no need to worry about that. Just you can take a screenshot of this slide, the main electrolytes in the body fluid. Your body fluid is made up of certain electrolytes. Okay, that is given in the table 11.4. Okay, some of the electrolytes are given in the slide. and others are given in the textbook. Sodium chloride, magnesium, calcium, and potassium. Just you have to remember these four electrolytes. They form the essential part of your intracellular as well as extracellular fluid. Okay. It has water, but along with water, what all electrolytes do we have in these fluids? We should know that. Okay. So these electrolytes will balance the fluids in the body. It will maintain your blood's proper pH. It will carry the electrical signals from the nerves to the muscles. All these electrolytes will help in the contraction and relaxation of parasympathetic, sympathetic muscles within the body, involuntary, voluntary muscles inside the body. Okay. Also, which part of the kidney is filtering it out, which part of the kidney is absorbing it out, is also given, like the glomerular loop of Henle, descending loop of Henle, ascending limb, and all. It is very technical, too much of an anatomical point of view. Don't worry about that. Okay. The classical example, like the main purpose of these electrolytes is given in the slide. If you know that, that's more than enough.